Okay, we're live. Can you tell us your name, please?
Yes, my name is Jan.
And Jan, what are your qualifications?
I'm retired now, but I am a registered respiratory therapist in the state of California.
And we've headed this is biowarfare because this is what you said.
Yes.
So tell us what is biowarfare and why you think it is.
Well, back in 2014, we had biochemical labs here in this state, and some of them got released. And after that, President Obama sent the biolabs over to China and other places. And we, as a country, United States, has been funding. We've given over $2 million to the gain of function research that's happening in China right now. So, or was happening, and before the COVID was released. So, yeah, we've been giving money to this kind of research for quite a while.
And so going on from that with the shots and everything that went on in COVID, what also do you think is biowarfare? The shots?
I think the way it's been handling it, first of all, I believe in preventative medicine. My husband did a lot of research, and we've been following frontline doctors. So I had COVID at the end of 2019, and it was just regular COVID. And then when the beginning of 2020, when it kind of hit the States, I went to my doctor and I said, because he knew I was working a lot with COVID patients, I said, I need some hydroxychloroquine and zinc. You need zinc to get it into the cells. And he said, sure, I'll give you some hydroxychloroquine. But all this time, they were just pushing, and they still do it, boosters. We had to all be vaxxed. We had to all get the boosters in the hospital.
Did you take any of that?
I did not get vaccinated. I fought it for a year. They made me do CPR tests every week, and then we got some legal papers to take to HR so I could file for both religious and medical exemption. So I didn't know any other people in the hospital doing that, but they did give me both religious and medical exemption. And I think it's the fact that we were so short-staffed during COVID that they couldn't afford to let me go.
So you didn't take the shot?
No.
So do you have myocarditis or pericarditis?
I don't believe I do. I think I'm healthy because I didn't get the vaccine. Because the vaccine is what does the harm. And actually, the statistics show that people who there's a higher mortality rate for vaccinated patients than there are unvaccinated patients.
Okay, so what did you see in your time on the COVID wards or working around it?
Okay, in the beginning, no patients could come in the hospital. I mean, the respiratory therapists work all throughout the hospital, ER, birthing center, everywhere. So we all have voiceras that we can talk to one another, and we have pagers for codes. So all of the patients that would come into the hospital had to be screened through the parking lot. Okay, so nobody.
For what?
For anyone who needed to come into the hospital.
Screened with COVID tests?
Yeah, right. Yeah, they would do COVID tests, and that's another thing. I believe most of the COVID tests were. I listened to the gal that was on the CHD. Her name was that did the lab tech, Holly. I listened to her. Very good insight about a lot of positive PRR tests because she wasn't able to run all the parameters on the PCR test, so most of them came up positive. So we had to wear the PAPR suits. If you remember what the PAPR suits look like, I have a picture of it if you want to see. It's the full, it's like the whole spacesuit thing.
So you got dressed up in a spacesuit?
Yeah, we all had to wear them and wear the packs, the oxygen packs.
You had to wear oxygen packs and spacesuits?
We all had to check out oxygen packs. Yeah, this is not a real good picture, but I think you all remember what what happened in the beginning, the white hood kind
So
of.
you looked a bit like that.
Yeah. So when we came into work, all the people who went into COVID rooms had to have the full suit with you had to check out the oxygen tanks and all of that to even go into the COVID rooms. So everyone, even in ER, if they came into ER, this is, can you just imagine all the money that's involved in all this? So every room that had a patient in the hospital all had to be retrofitted for negative pressure rooms. So the hospital had like 4 or 5 isolation rooms for tuberculosis, for any kind of respiratory illness, TB, but then once we got past using those, the engineers actually had to retrofit every room with these big ducts that made all the air go out of the rooms out to the exterior. So, and those machines that run that make noise. So respiratory therapists are always carrying around a stethoscope and listening to patients' lungs, because we can diagnose by the sounds we hear what kind of diseases they have. Well, when you have on all of this equipment with hoods and all of that, it's hard to even listen to anybody's lungs. So so that went on for about 6 to 7 months, where they just screened people and brought them into the ER from the parking lot, because they didn't want people waiting in the ER waiting room. So that was like the beginning of COVID when that happened.
So we have a lot of people that report, they come in, they're unvaccinated, all of them that we've seen on the bus, that come in and they get put on remdesivir after a positive COVID test. They all start off with this pulse thing that they put on their finger.
Right.
And often some of them don't even feel unwell, maybe a little breathless, not quite sure what's going on, but they're manically checking to see if their oxygen stats go below 90.
Right.
And then they're going straight into hospital. And all but a handful are not coming back out again. They're vented and they're gone. So first of all, let's talk about that thing that goes on the finger.
It's called a pulse oximeter, and it measures the percentage of how much oxygen you have in your blood. Okay, the percentage of, like I said earlier, the hemoglobin carries the oxygen, so it's the percentage of how many hemoglobins that are running around in your circulation that are carrying oxygen. So if I was at 88%, let's say, 88% of hemoglobin would be carrying oxygen. So with the combination of the positive PCR test, which could be true or not, depending on whatever PCR test you get, or how the PCR test is run, plus having a lower oxygen level, plus having any symptoms, almost everyone was admitted with that scenario.
But surely, and I don't know anything about this, is my question to you, surely, so forget COVID for a second, when we get sick, when we have a really bad cold and we can't breathe, or we have flu, or whatever the normal things that we get every sort of winter or whatever it may be, surely our oxygen stats are going to drop, and many of us would have not even known about it because we never had one of those things on our finger.
Exactly.
And we feel like terrible for days, can't really breathe, but then we get ourselves back together and we're fine, instead of going into hospital, being put on a ventilator and dying.
See, this is why I believe within the first, there's a graph I have, within the first 2 to 3 days when you first start having symptoms, that's when you treat. You treat prophylactically with either ivermectin or hydroxychloroquine with zinc. I did that when I started getting symptoms, and it was gone within 24 to 48 hours.
Quercetin, that was our kind
Quercetin's another one.
Good stuff.
It is. It is good stuff.
Not that any of us are giving out medical
See, now,
advice, if anyone's listening.
There's always a disclaimer, right?
Has to be done.
Right. And okay, so first of all, when Trump said he was feeling much better after the weekend being in the hospital, I don't know if you remember that, and he said the word hydroxychloroquine, I think it was just like blacklisted from there. we know it works. In fact, the country of India, they gave out what they call Goa tests, Goa packs. And you know, India's got the same population we do. They've got millions and millions of people, maybe even more now. But so they gave out these Goa packs that cost the country like $2.64 each. And the Goa packs had ivermectin. Vitamin D is very important to fight off any infection. Vitamin D, I think quercetin or something. Yeah, there's a list of everything that was in this pack. All the people in India took this within the first few months of it hitting globally, and they didn't have anything like we had here in the States. They were all prophylactically taking preventative medicine to prevent COVID.
So, as a respiratory person that you are, were you involved in the venting process?
Yes. Respiratory therapists, okay, we go through the same time training as nurses do, but in a totally different field. We learn all about pulmonary diseases, all the machines that people are put on when their lungs are in bad shape. So basically our job was, it's acute care, we're frontline, to be sure that everybody's oxygenation was good on whatever machine we could get them on. It was pretty much determined within the first 6 to 7 months I heard in the hospital, please don't put these patients on a ventilator, because then they have a 50-50 chance of ever getting off again, okay? So we have vapotherms, which go up to 100% oxygen. We have BiPAP, so we were dealing totally with those machines unless the doctor said, no, we have to transport this patient to ICU and intubate, okay? So we were always there with the intubations. We ran the ventilators, we ran the BiPAPs, we ran all the equipment. Even somebody who's just submitted and they need a little bit of oxygen, we handled all respiratory equipment and did all the turnaround. We cleaned them, we did everything with them. About the going into 2020, halfway through, every morning, I worked night shift, 12-hour shifts, and we all worked a lot of overtime because we were short-staffed, okay? But the state of California called our department, or my boss, they wanted to know how many people were on ventilators, how many people on BiPAPs, how many people on vapotherms, so that they would know whether there's enough oxygen, whether we need to borrow ventilators, whether we needed to get more oxygen, all of that. So every day we had to have that report for them before 7 a.m. in the morning.
But the people who sit where you are now to talk about their loved ones who they say were killed, they don't believe that their loved ones should ever have even been on a ventilator. They believe that, and when they look at the medical notes after they died, they were given paralytic drugs so that they couldn't fight back, and then before they knew it, they were force ventilated, and then fentanyl and death.
Yes.
What did you see as you were going? Did you see them struggling, or were they beyond? They were out of it.
Okay, remdesivir was used a lot. Unfortunately, there was an immunologist at the hospital that I worked at, and she pretty much prescribed remdesivir, dexamethasone, a lot of vitamins type of things. We had a problem with patients wanting to take their oxygen off, and that wasn't helping at all. So, and there are certain ethnic groups that had a higher incidence of COVID, and I don't know why that is, but it's biologically been proven that happens. So they just don't respond as well. But I do believe it was a lot of people are fighting adverse reactions. So
you have notes there. What else do you want to tell us?
Well, there's actually Okay, I believe that this is spiritual warfare, actually. I do believe, because we're seeing a lot of different offshoots from people dying. There's like, I call it the evil triad. They've got MCAS, I don't know if you've heard of that. That's mast cell activation. It's called POTS. Like 1 to 3 million people have got POTS, which is postural orthostatic tachycardia syndrome. And I know some people that I worked with, other respiratory therapists, who've had those symptoms. And Ehlers-Danlos syndrome, which is another. But these are all diseases that are offshoot from the mRNA in the vaccines, affecting the protein, which creates a spike protein. You've heard of that? The good news is we have medicine to fight that. Okay, and then the spike protein going and messing up the whole immune system. You know, I believe, because I'm a Christian, I believe that our bodies are made in the image of God, and that it's miraculous when you study biochemistry. I mean, everything inside the cell communicates with each other. We know exactly what to do. But these are affecting things like mast cells. Okay, mast cells in your immune system are like the sheriff. They're like the one that give all of the directions. And when they're messed up, they live in the bone marrow. When they're messed up, nothing goes right. They're telling the neutrophils to make these webs and clog up your blood, your circulation. So that's why J&J took their vaccine off, because there was a lot of coagulation and stuff like that happening.
In the Johnson & Johnson, which is not
Yes.
an mRNA shot.
I don't believe
No,
if
it's
there
not.
were, but they were still causing clotting, I know.
Right, because it's the same as AstraZeneca in
Right.
England, where they saw all these problems and lots of cancer and all that kind of
Right,
stuff.
right. Yeah, so they are, but see, okay, with the children, I know you've seen the listing of how many vaccines. I would say don't give any vaccines to children, okay? They are fine. We told our son, we're new grandparents, we said, please don't give her any vaccinations. The only vaccinations that have gone through any kind of preliminary testing are the MMR, which is,
For how?
okay, and right, for measles, mumps, and rubella.
Yeah, I mean, that's
Yeah,
what injured my
but
child.
this is what, okay, but then we're having millions of people come over the border and they're not vaccinated, okay? So they're bringing measles, mumps, and all of that. But still, I believe that our
Do we
own
know that
immune
to be
system.
True, that they're bringing do we even know measles, mumps is around right now, or did it ever? Here's my question: did it ever go away? I don't know. I mean, I come from an era where I got measles, but it was really hard to catch it. You had to go to parties and forever until you
Right,
caught
right.
it. I think there's a big lie going on here.
Yeah, there's a lot of lies going
If
on.
the immigrants are unvaccinated, then they're a lot healthier than we all are.
Okay, so
I'm not buying it. Sorry.
today's Good Friday, and you know we're very blessed. We're very, very blessed to have this bus here, and that's because people are speaking the truth out.
That's right.
And
but I don't think we can say that there is anything. There's no safe and effective vaccinations. Even the CDC
No,
says that
no.
unavoidably unsafe.
No, that's true.
So I think we need to get that one out there clear. We've seen the health of the unvaccinated. Everybody
Yes.
can see that.
Yes,
So
yes.
it's undeniable, all of that. And
That's
I
true.
thank you for talking about the, pulse oximeter, whatever
Yes,
it's called,
yes.
and what you saw during COVID. But I cannot sit here with anyone and speak to the people and say there are some that are approved. The MMR is one of the most dangerous vaccinations on the market. If you look around this bus, you will see MMR absolutely everywhere.
Yeah, I know,
So
and it's not
There's,
good.
Approved by who?
Right,
Not approved by
right.
God, I can tell you that.
Right, no, and you know, Jesus said that He is the way, the truth, and the life. We need to get to the truth. And the only way we're going to get to the truth is to do our own research, to take time. It's not easy. This virology, there's more people illiterate in virology, including physicians, than There's just a very few people. But there's books out there. Even Robert Kennedy, who helps Jr., who helps with this ministry, he wrote the Wuhan virus, Wuhan cover-up, right? So the truth is coming out. Jesus said that he was the way, the truth, and the life, and we need to be advocates for our own bodies and for people that we know, to let them know the vaccines are harmful, very harmful. And I've lost a good friend of mine. She died from the shots she took. She was a 30-year, she'd been in respiratory for 30 years. She had worked in the ICU she used to work in the ICU a lot. And she just went home and was watching television with her husband, and she stopped breathing.
Did you take the COVID shots?
Yes. It was a miracle that I did not have to take the shots, really. Everybody in the hospital pretty much did, or I would have lost my job. I think it was because of my age. I thought, well, I'm either walking or they'll let me stay just because they need me there. But what was I going to say? Yes, this is crazy. There's like, 15, 20 vaccines. I say don't give babies any vaccines. Another thing that's political about this is in 1986, President Reagan, of all people, passed a law that gave legal immunity to all vaccine manufacturers. So there's been no liability at all until recently, and this is in the Defender, which is another part of this ministry, is there is a it's for businesses and people to be able to sue for adverse reactions and for vaccine injury. And it just came out in March of this month. So there's progress happening, but it's people like you all, and I felt terrible what was happening in the hospital. I would talk to other respiratory therapists and say, if they just treated this right from the beginning, none of this would be happening, because ivermectin is a fantastic drug. It's been used for decades. Hydroxychloroquine, the same thing. And I was very grateful to get it. Every time I went into my doctor's office, they kept asking me, well, have you had the shot? And I said, no. I said, why don't you just put a permanent piece of paper on my chart saying I will not get the vaccine. And but he was nice enough to give me a prescription for hydroxychloroquine, because he knew that I was in and out of those rooms. And but I didn't like what I was seeing, and I talked to other people about it too. And but we were there for the people. We were trying to get them out of that hospital if we could.
Well, thank you for that, and thank you for what you do. Is there anything else you want to add?
I just pray that that people's eyes will be opened quicker, and that people will be able to take nattokinase. I have a list of frontline doctors' medications.
Well, so everybody knows they can go to the frontline.
Yes.
Doctors, the FLCCC.
Yes.
We don't want to be giving out medical advice. So
right.
They're the people that you should go to if you want to.
Nattokinase is excellent. So that's what we take, and
Thank you for doing this interview.